Okay, I think we'll get started. Good afternoon, everyone. Our program today, time to talk about burnout, poetry and other things, doubles as a Department of Medicine grand rounds. My usual co-conspirator, Chief Resident Anthony Peters, is actually away at a fellowship interview today. I'm Marcia Day Childress from the Center for Biomedical Ethics and Humanities, and it's this center that brings you the weekly Medical Center Hour. The subject of burnout is urgent for practicing physicians and urgent too for today's residents and medical students, physicians in training. But burnout happens not just to doctors. Nurses burn out, and so do other health professionals working to care for the sick and the suffering in complex institutional settings. Multiple personal, social, organizational, and regulatory factors contribute to burnout, which is a chronic stress syndrome characterized by exhaustion, depersonalization, and pervasive feelings of inadequacy. When severe, these symptoms are often accompanied and exacerbated by depression, and they sometimes distressingly lead to suicide. We've asked internist and longtime medical educator Dean Gianakos, who's Director of Medical Education and Chair of the Wellness Committee at Centra Health in nearby Lynchburg, Virginia, to talk with us today about burnout. Contrary perhaps to your expectations, Dr. Gianakos will not be teaching us techniques to bolster our emotional resilience or better manage our time in the face of incipient burnout. Nor will he be venturing how we might reduce or reform the maddening inefficiencies of clinical practice. Rather, he's going to engage us in a conversation about how clinicians can emotionally support and companion one another, specifically how we can initiate crucial exchanges with colleagues, in part to reduce the isolation that too often characterizes doctors' and nurses' clinical days. Your handout includes background information about Dean Gianakos. There's also a rich list of resources for you about burnout and about why it merits our personal, professional, and institutional investment. Let me quickly, too, say that Dr. Gianakos declared no financial conflicts of interest for this presentation. And now, please join me in welcoming Dr. Dean Gianakos.
Okay, thank you so much, Marcia. What a privilege and pleasure it is to be here. So don't moan when I say what I'm going to say right now. I want everybody to stand up. Stand up, yeah. All right. We're going to make a little time to talk to one another. So here's the assignment. Everyone paying attention? I want you to, and I know this room is not conducive to this, I want you to find a person in this room that you do not know. And this is what I want you to do. You're going to have a conversation with that person. I want you to talk to them about something that you feel that you've done recently that you feel really good about. It could be a small achievement. It could be a large achievement, something you've done in the last few weeks. Let me give you a few examples. I changed a tire without calling AAA. I fixed a computer glitch without calling the help desk. I gave feedback to an overly sensitive, defensive colleague, medical student, or resident, and it went surprisingly well. I talked to my teenage daughter last night, and for the first time in 2 weeks, she didn't talk back to me. Okay, everyone clear on the instruction? Then you're going to reverse roles, embellish it, really get into it. Go. Okay, let's bring it back to the big group. Thank you. Okay, so that's the end of my talk. It's been a great pleasure being here. Thank you all so much. So I want to hear from a few folks in the audience. I tend to call on people. If you don't want to talk, you just say pass. Dean, do you want to take it? What's your first name?
Waleed.
Waleed, I want to hear, how did that feel to you?
It was good. I mean, it was kind of nice to, just take my mind off work for a minute and just chat about something completely unrelated and something that made me feel good.
Did you brag about yourself a little bit? You don't have to share it.
I don't know. Did I? What do you think?
That's beautiful. One more here. Tell me your first name.
It's Preston.
Preston, would you like to share how that felt for you?
It felt really wonderful to engage with someone about family and their daughter's journey in life and hearing about her successes. And it feels like I'm a doctor listening to my patients talk about the good things that happen.
That is beautiful. Thank you for that. Thank you all for sharing that. So the title of my talk is A Time to Talk. We're going to talk about burnout and poetry and other things, but that's a start. Try not to get a little bit emotional here. I want to first of all thank my great friend, Dr. Robert Battle, who's sitting in front here, and his wife, Martha. Bob and I were classmates at the University of Virginia School of Medicine. We started in 1980, and we were in, I don't think it was this auditorium, it may have been the one next door. And I remember on the first day of medical school, Bob and I listening to Dr. Ed Pullen. He was professor of anatomy at UVA, and he was giving us wise words of advice about the serious work ahead of us. And that was the first day in 1980, and I'll never forget that. And I was paying particularly close attention because he also happened to be the director of admissions. And I'm forever grateful to Dr. Pullen because he was the person who was largely responsible for me getting into the university, because he was the one also to whom I had to explain why I got a C- in my organic chemistry, one semester in organic chemistry. And he asked me why, and I said, this is not a great reason. I was skipping my organic chemistry classes to audit courses in the humanities, particularly philosophy. And he was understanding of that, and so I'm forever grateful to Ed Pullen. And so how beautiful it is for me and what an honor it is for me to be talking about medicine and the humanities today. So before I tell you about this physician, and some of you may recognize him, I want everyone in the, well, not everyone, raise your hand if you have known a colleague who has attempted suicide or committed suicide. Raise your hand. Gosh, large number, yeah. So this is Dr. Abraham Verghese. He is professor of medicine at Stanford University, and he's also a well-known writer. He's written several books, more than several, The Tennis Partner and Cutting for Stone. I had the privilege of listening to him last year in San Francisco. He gave the first annual, this was at the first annual conference on physician wellness. And he opened his talk with the question that I just asked the group. And it was a group of 300 to 400 physicians, and the great majority of us raised our hands. Then he asked us, we were at tables of 8 or 9, to find a time to talk about that experience. So the woman sitting next to me started talking about a colleague of hers, a resident colleague, who had committed suicide, and she had lost track of this person until she'd gotten the news. And then before she could finish her story, she broke into tears. She said, "Dean, I've never shared this story with anyone before." So that was really, really powerful. So I've been interested in burnout for longer than that, but we're here to share stories and find a time to talk. So what are we going to do today? I'm going to talk a little bit about burnout. We're going to talk a little bit about burnout and poetry and what poetry has to say about meaning and purpose in life, and how we can connect to our colleagues. Also, a few words about how to learn to look, and metaphorically, to read a colleague or read a patient. And also the very difficult thing to do is to approach a colleague, to have the courage to approach a colleague about possible burnout, to have that conversation. So many of us are maybe in the room are starting to get tired of reading about burnout, getting burned out about burnout, okay? So as Marcia said, it's a chronic stress syndrome characterized by emotional exhaustion, depersonalization or callousness to other people, and a low sense of achievement or accomplishment. It can be complicated by depression and suicide. So this is a study from Tate Shanafelt, who was at the Mayo Clinic. He's now at Stanford, Chief Wellness Officer there, and it's old data. Burnout rates have gone up from 2011 to 2014 from 45% to 55%. And just a little footnote about this data, it's coming into question. There was an article in JAMA September 18th that's really calling into question a lot of the data that's been done on burnout, a lot of the validity of the instruments that are used to measure burnout. So suffice it for this talk, we're going to say that burnout rates are about 50%. Just know that this is really a area that's in its infancy in terms of research. All right, I could talk for several hours on contributors to burnout. I'm not going to do that. You see in red what we're going to talk about. We're going to talk about the isolation, loneliness that physicians, nurses, and other healthcare professionals experience. The others on that list, personal factors, have to do with resilience or personality traits of those of us who go into, generalizing, that go into healthcare fields. Organizational factors, this is probably getting the most attention in the burnout literature, what we can do to try to address the inefficiencies of healthcare, particularly the electronic health record, workflow processes, and also the culture of medicine. And the regulatory factors refer to how physicians and others get paid and the burdensome requirements that we have to do in order to get paid. I couldn't resist one quote from Albert Camus, French existentialist, about resilience that I found this. It was not in one of his major works. I can't remember where I found it, but I love this. In the midst of winter, I found there was within me an invincible summer, and that makes me happy. For it says that no matter how hard the world pushes against me, within me there's something stronger, something better, pushing right back. And having read a lot of Camus in my 20s, what I would say to this is, yes, this is true, and this resonated with me when I was reading Camus in my 20s. What I would say is that everyone, however, has his or her limits. That if the load is great enough, there may not be enough within us to overcome. So why burnout matters? Burnout matters because it erodes professionalism, it affects quality. People make more mistakes when they're disengaged. Not to mention financial factors that increased turnover has repercussions for the healthcare system and finally leads to worse patient outcomes. I just want to point to, this is again by Tate Shanafelt, notice the year, 2002. So 16 years later, we're starting to get some traction on this major issue. So I'm going to switch gears again. Some of you may recognize this man. This is Dr. William Carlos Williams. He was a general practitioner in Rutherford, New Jersey, a blue-collar town, where he practiced general, he was a general practitioner, delivered lots of babies, did a lot of pediatrics, and made a lot of house calls. He worked day and night, and in between patients, he would scribble lines of poetry on prescription pads. He's better known as probably one of the foremost poets of the 20th century. So reading poems, reading colleagues, or reading patients. So physicians do a lot of things. Before the patient even enters the exam room, let's say I'm the patient, and I'm walking down, and I just catch a glimpse of this patient. So I'm trudging slowly. Okay, so I pick up on that. Oh gosh, there's an intuition that I have about that patient, okay, because I have a lot of experience seeing patients, and I recognize patterns. And so already I'm starting to think about, gosh, I wonder if this patient has Parkinson's disease. I wonder if this patient has had a stroke. I wonder if this patient is depressed. Or I wonder if this patient's leg has gone numb because he's tired of waiting for me in the waiting room. In the waiting room. Okay? So those are some of the questions. Then patient gets in the exam room, and then the analytic mode kicks in. I have a conversation. I start asking questions. My differential diagnosis starts shuffling in my head as soon as that patient opens his or her mouth. And so the intuitive and the analytic work together. The same thing happens with a poem. I have a sense about a poem. Gosh, not sure this is something deep and I don't really understand it and not sure what's going on there. There's I have some intuition. Then I switch into my analytic mode and I start asking questions of the poem. Gosh, I wonder why the poet titled the poem this. What about the form? What about the metaphors? What about the similes? What about the punctuation and the language? And we know how important language is in medicine. We know how important empathy is. In a poem, I have to release myself a little bit, use my imagination to get in the shoes, so to speak, of the narrator of the poem, just as we do with patients. So here's the next exercise for the group. This is a well-known excerpt from a poem from William Carlos Williams that I have never read the entire poem because I like really short poems and I don't have patience for a long poem, okay? So don't anyone ask me about the Asphodel poem. This little excerpt I've read hundreds of times and used it in teaching and retreats and conferences. So this is the assignment for the group now. I want you to, with 2 or 3 of you, to talk about this poem and ask yourself questions about the poem, reflect on it, and try to figure out what William Carlos Williams is communicating in this poem. All right, so everyone clear on it? So talk to 2 or 3 of your colleagues next to you and have some fun with this. Okay, so I'm gonna mosey up the aisle here, and I know you're like, Dr. Gianakos, don't you dare call on me, right? Right? All right, what's your first name?
Justin.
Justin, do you mind sharing? You do not have, Justin, you can take it?
I'll share.
Oh, beautiful, thank you so much for doing that.
All right, so you were talking about the analytical mindset, and I think most of us are more on the type A analytical spectrum. So when we see something, we're trying to say, all right, what's the point? What's he trying to say? And then move on. So we were thinking kind of in that mindset, but it's difficult to get the news, like the facts, the message, the point right away. But poetry maybe and other forms in general aren't necessarily just about like what the message is and what's the point, but like how you interact with it, how it makes you feel, how it makes you think. So the second half we didn't really make sense of, but I guess maybe that's part of the point they're trying to make. It's not just about getting the message right away. So I don't know.
Gosh, thank you so much. One of the things I love about doing this is I learn something new about this poem every time I do one of these sessions. That's fantastic. Thank you for that. Someone else want to volunteer before I call on somebody? Oh, gosh, I just love volunteers. This is just so awesome. Tell me your first name. Christina, you're awesome. Thank you.
So I agree with the interpretation of the first part, and I think the second part is trying to say that even though you can't get the facts and important information, what it does have is artistic expression and emotion, and that's, if people are missing that, that's why they are not happy.
Mm-hmm. Okay, thank you so much for that. Maybe I'll take one more. Okay. Yes, okay. Dr. Baldwin here, row. Yes.
I'm thinking that our patients, I'm also a doctor, our patients are like poems, and when they come to see us, we are looking for the proper diagnosis, and we don't make it all the time. And there are hidden things in our patients, and the thing that comes to mind is the will to live. I think that can be very fragile, and we make diagnoses like upper respiratory infection and arthritis and angina, and we may miss the what's really making that patient tick, and therefore they go away unhappy or undiagnosed.
Gosh, thank you. So patient is like a poem. I love that. Thank you so much. I mean, we could talk a lot about this poem. You know, Williams is, you know, what does he mean by news? That's something to reflect on. And they actually die miserably from lack of not reading poetry. That's pretty startling. I've thought about this poem a lot, and I've written about it in the past, and as I mentioned, I've done seminars on it. And in the last year, I gave more thought to this poem and how I might connect it to physician suicide. So after reflecting deeply on this and the burnout crisis and suicide in particular, I crafted a story to try to make a connection between poetry and suicide. And it's a little bit obnoxious, but I did write this story. I'm gonna share it with you today, and I want you all to read the story and make connections for yourselves and see if it resonates with you. So I'm gonna need some help passing this out. After you read the story, spend a few minutes with your colleagues, the people next to you, and just talk about it. Okay, let's bring it back to the big group. I'm gonna walk up the aisle here, hopefully get a volunteer to comment. Any volunteers as I'm walking? Gosh, what's your first name?
Rebecca.
Rebecca, thank you for volunteering.
So we were the first thing that stuck out to us was the point about the early years and sharing dilemmas over lunch and how important that was. And I was thinking about my life, and I'm still a student. I'm not, a doctor, hopefully yet. But having that time with my friends to kind of talk about the stressors in life. Last year, I did that all the time, and then this year I haven't found a time yet to hang out with these 3 friends, and I haven't had the time to process all the stuff that I'm dealing with in my life right now. So that definitely hit home for me, and I can see how that would be very necessary in the medical field.
Gosh, that's a summary of my talk. Really, that's beautiful. Finding the time to talk. It's a small thing, but it's a big thing. Thank you for that. Yes. Tell me your first name.
My name is Jordan.
Jordan, thank you so much.
I'm a nursing student, and I think one thing looking through this is it reflected for me in clinical. We have all these tests we have to do every day, and there's 1,000 things you have to do within an hour. And at the same time, it reflected the importance of sitting down and taking the time to talk with the patient, ask them what's going on, and really get to know them better, aside from just running in, doing what you need to do, and running back out and going to the next patient.
Great. Thank you. That's fantastic. I'm going to walk down this way. Are anyone from up here any volunteers up here? Okay. All right. I'm not calling on you. Okay, I've got one right here sitting down. Yes, tell me your first name.
I'm Curran.
Curran. Yes,
Yeah.
thank
We
you.
were just talking about how easy it is to slip in these ways. You stop doing one hobby, then you stop doing another hobby, then you stop caring, and there's just a downward slope, and how it's so important to identify that and to put in place new routines or checks or venting to someone or just intervening as soon as you notice yourself slipping in that way.
Beautiful. Yes, thank you for that. Yes.
My name's Nico. I'm a second-year medical student. This makes me think about I mean, we're all going into medicine, and or I'm going into medicine, and there's like always going to be a lot of work. There's always more work. There's more tests to run. The ultimate goal is like trying to help people get better. And there's always like more tasks and maybe more treatments to administer. But you have to think too about like the number needed to treat of people that might be depressed or like having more serious mental health issues. And that's work too. So stopping to take time to talk isn't taking you away from the ultimate goal of your work. It might also help people get better.
Fantastic. Thank you. Thank you very much. We could spend more time on this story, and I could refer to my friend Bob Battle, who knows more about Robert Frost than certainly I do, and probably many in the room. The poem at the end is by Robert Frost, and that I've just loved that poem for a very, very long time. And to be able to connect that poem with William Carlos Williams' poem for me was like, oh my gosh, that's what it is. If that Frost poem stays in your head when one of your colleagues walks by you and has a meaningful walk, there's something, you get that intuition that something's going on. That's the time to put your hoe in the ground blade up, put your phone in your pocket, and find a time to talk. So so thank you for that. Veering off a little bit, I teach a course at Centra Health called Crucial Conversations. It's a national course, and it teaches people how to have crucial conversations. And a crucial conversation is a conversation characterized by high stakes, opposing viewpoints, and a lot of emotion. So you can imagine, oh gosh, medicine might have a few of those. So crucial conversations in medicine include breaking serious news, admitting a mistake, talking to a patient who's demanding opioids from you. That's a lot of that going on today. And I would put these conversations about burnout, asking yourself about it, or initiating a conversation with a colleague as a crucial conversation, because you risk, it takes a lot of courage and it takes a lot of humility. You risk, unless you can make it really, really safe, psychologically safe, you risk someone getting super defensive. So I've been interested in the patient-physician relationship for a long time and have done a lot of reading, practicing, and coaching this Crucial Conversations, and you can ask me more about this at the end of the session, puts it in a framework that is really powerful. Here's the model. It used to be a 2-day course, and I can tell you the first day, if you look at the top, the first day was work on me first. Work on me first. And that's about, and I don't have time to get into this, it's basically about increasing your self-awareness and your social awareness. That's probably the most important part of the course. That pool of shared meaning in the blue is how can you get someone to, how do you get your patient to talk, how do you get a colleague to talk about a very sensitive issue, making it safe. You'll see the gray, making it really safe for that person to open up. And then on the other side, which takes courage, if you tend to be more on the timid side and are afraid to express your viewpoint, takes courage, and that has to be developed too. That takes awareness of where you are on that spectrum. Are you more kind of, gosh, I got to get my point in at this meeting, or I'm just going to hold back all the points. If it's an important meeting, and why would you be meeting if it's not important? Don't answer that. You want to get everyone's viewpoint into the pool of shared meaning, the facts, the opinions, and values, so that you can move to action. This is not soft, gushy, warm, fuzzy stuff. This is about getting results, and it's about building relationships, cementing relationships so that you can get results. And the burnout conversation is one of those conversations. So we're getting near the end of my talk. I would leave you with this, that to be intentional about, purposeful about starting to look. I gave that example of the patient trudging down the hallway. Maybe it's a colleague that starts to trudge down the hallway. Or maybe Dean's shirt tail is out, and normally he's really well-groomed. Maybe there's something else that you just can't put your finger on. And then ask yourself, is it a time to talk? And if you don't have the courage to do it, then maybe you role play with someone else who can help you with that, help you with that conversation. So I'm going to end on a poem, and I was going to hand it out, but I'm just going to read it. This is a fabulous poem about the joy of medicine. It was in the Annals of Internal Medicine. I have copies for anyone who would like it up at the front. I'm not going to pass it out for sake of time because I want to leave some time for questions. It's called The Joy of Medicine by Joseph Gatcho. I think that's how you pronounce it. Gasho, is that right?
He used to be here.
Oh, is that right? Gosh, oh no, I did not know. How about that? Really? Okay. No, I did not know that. Fantastic. Okay. The Joy of Medicine. It's about the man who pilgrimages to Talladega every October because you stented his widowmaker, and the couple celebrating their 60th who asked everybody to stand up and clap when you walked into the VFW hall, and the time you were in the shower and you thought about what the wordy lady told you in the office the day before, and you ordered the blood test and prescribed the right pill, and all was well, and it would not have been. And looking back now, believe it or not, it's answering the stat page at the Little League game in the bottom of the fifth, right before Maggie hit the ball to right field and slid into third with a triple, and leaving the warm bed with the candles burning to speed to the ED to sew up the drunk's aorta, and when you got home, she was sleeping. But most of all, it is about the long-haul trucker who runs to Reno twice a week, who doesn't know he should be dead, but you do. So in summary, I've said this, learn to look for burnout in your colleagues and yourself, then ask the question, is it time to talk? If so, thrust your phone or your hoe, okay, and initiate the conversation. Thank you very much. I'll answer questions here. We've got a little bit of time for questions, so.
We have another one of these wireless mics, and now that you're all primed for offering comments and questions, we'll gather more from you now. And actually, I'll start because one of the things that struck me too about the story that you wrote was that there's one thing about learning to read, learning to look, and learning to read your patient or your colleague. And we all notice things about the people around us, the people who matter to us, the people we're working with, but we don't always act on what we see. And in your story, Jane makes herself available. What happens when the person does not make him or herself available? How do you begin? I guess it goes back to those crucial conversations. How do you act on what you notice?
Right. So it might be, I'll use Bobby here. I use my friend. So crucial conversation. So it might be, gosh, Bob, do you have a minute? It'd be okay if we talk for just a minute. Would that be okay? By the way, when you ask permission, that really it helps to make it safe. Very few people, depending on how I ask it, are going to refuse. I noticed for the last couple weeks, your shirt tail's been out, your hair's been. You're such a you're such a neat dresser and well groomed. As your friend, I'm just curious. Anything going on? And by the way, the motive really matters. So in my heart, I'm worried about my friend. The motive is everything. If I'm asking that question because I want to look good myself, or hey, what's up? I'm trying to make myself look good myself, or punish him. I'm the chief resident. Hey, what's the deal here? Well, you're not, you don't have your hair, combed, and your shirt tails out. Your white coat looks bad. What's going on here? That ain't going to work. So it's about making it safe so people can open up.
What would you have to say?
Well, Dean brought up Robert Frost, so I think sometimes what happens is that the more successful we get, the more vulnerable we become, because it becomes harder and harder to find that balance. Mm-hmm. And After Apple Picking is a great Frost poem, and it really cuts to that because the orchard owner has been harvesting the apples, and it was a great harvest. But I am weary of the din of apples upon apples rolling in. I am overtired of the harvest I myself desired. And I use that metaphor in my practice all the time. If I'm meeting with people and they have these grand plans, say, what are you going to do if you're really successful? Because you may not be prepared to handle it. Mm-hmm, mm-hmm. And I think that can happen a lot in medicine, where it amplifies and it amplifies and it amplifies, and you really never get time to slow down and assess it.
Beautiful. Thanks, Bob.
Other questions, comments? Or your own stories?
Hi, this is Carol. I'm one of the nurses here, and in that story with John and Jane, I think too, Jane could not stop her world and take a breath and figure out how to get this organized, and not keep on this track to burnout until she said something to John. Whereas John, even though he had as much going on as Jane did, he was able to say, stop, I'm not gonna go pick up the child, I'm not gonna finish the records, it may be after midnight before I get done, but I'm gonna stop. And sometimes we know maybe that we have to help somebody, but you've got so much on you that you think, okay, so who's gonna suffer here? That person, or my family, or me, or my other patients? So I think it's a balance there I think we fight with on a regular basis as to how do we stop what we're doing and, just kind of take care of ourselves as well as another person who might need help.
Gosh, Carol, that's just a great point. And, John struggles with that. He looks at the computer, which, he's looking at the time. He's getting texted presumably by his wife to pick up the child, but he has an intuition. She's walked by several times, and the other thing I'll say, it's his colleague. It's not. So your point's well taken. We can't stop for everyone, but your practice partner, you have to make a choice about who you're going to, and that intuition too. So thank you for that.
Other comments? Questions? Does it make it more, does it make it easier these days if we are all informed about the importance of self-care and wellness? Those didn't used to be part of the vocabulary for physicians and other health professionals in practice. Does that help?
Maybe another physician in the room can take that question. I'm happy to answer it.
Yeah, Marcia, thank you for handing me the microphone. My name's Tim Cunningham, and I direct the Compassionate Care Initiative at the nursing school.
Fantastic.
We partner with the School of Medicine around the university, and I think we're finding as we are bringing the discussion of self-care, compassion, resilience to language, to classroom settings, to clinical settings, I think we're heading an interesting point where people are talking about it more, which is great, but it's almost becoming lip service. If we talk about it but don't do anything about it, then we're not moving forward with it. So I think we're also charged with how do we practice it, and how do we recognize some of the research we're doing now, recognizing that self-care is as diverse as the communities that we're working with. So if we say it's this, this, or this, we're potentially missing out on caring for other people. So as we learn more about it, we're learning it's such a broad field. And I really appreciate your comment earlier about how this is new research, Shanna Feld's work. It's really important to look at, but it's the tip of the iceberg right now. So thank you for bringing this forward.
Thanks, Tim. That's great. Fantastic.
Dean, thank you very much. Are there not some people for whom isolation is actually self-imposed and an important defense, and that one is taking a chance when one tries to penetrate that?
Yes. So you're saying that if someone's withdrawn, isolated, and that speaks to, again, Michael, even that person, if you make it safe enough for them, will open up. I firmly believe that. So that's a matter of trust. And I think about, I mean, you know as well as I do, there are patients, and it may not happen on that first visit, but over time, it doesn't take long. They know if you're the real deal or not. They know very, very quickly. And so I'm not saying they're not patients that have pushed me away or colleagues that there are. I think I've gotten much better in terms of making it safe for most people to open up and share. And if I offend them in any way, which I make mistakes all the time, then I quickly apologize. Or I use what's called a contrasting statement. I said, "Oh my gosh, Michael, I didn't mean to suggest that I don't like working with you. I absolutely do. You're one of my finest colleagues. I do want to suggest that for this project that we're going to be working on, I think there are better ways, there are additional ways that we can explore. How does that sound to you?" Right? So what I did there, I didn't say but, okay? I didn't say but. I highly value you. And then the next statement was, this is what I really want. And what I'm suggesting is, yes, you're great. We can be greater together. And then I'm getting your buy-in by saying, gosh, how does that sound to you? Then you get to respond to me. And if you still ticked off at me, I'm sorry I then I keep going back. I'm sorry I offended you. And I get back to what we really want to do together. Not easy to do. And I'm not saying I'm successful at it all the time. Absolutely not.
I'm going to put a chief resident on the spot here and just ask, how does this compute with you in terms of your responsibilities for the chief residents in looking after your flock? Yeah.
Thanks. That's actually a great question. I think a big part of what we try to do is at least help our residents, make sure that they're taking care of ourselves. So a question I actually had for you was going to be, what do you say to the resident who's maybe sitting in the back of the room, 6 pages deep that are unanswered, thinking, we spend a lot of time talking about wellness, and that's great and it's good for spreading awareness, but how does that help me as someone who day in, day out is working, 70 hours a week, really translate that into, an improvement in my own kind of morale or my own kind of personal state?
Yeah, gosh. Rephrase the question again for me. That gives me time to think about it.
Yeah.
Say it one more time.
I guess, what do you say to the resident who is sitting in the room thinking, oh, we spend all this time talking about wellness, but has kind of become a little bit jaded and cynical from just hearing a lot about it, but not necessarily having the time in their busy day-to-day to actually practice it?
Right. Again, I think that's a conversation. It's a conversation that, and we're so used to medicine. Oh well, what's the give me the 5 diagnoses. Oh give me 5 things. We're so Well, I'm here to tell you that's a conversation. It may be, again, I'm going to go back to. Tell me your first name.
Waleed.
Waleed. Gosh, Waleed, I noticed that the last two lectures you sat in the back and were talking to, your colleague and weren't paying attention. You seem to be not really interested in this topic. Help me understand what your thoughts are. And how you approach that conversation is everything. If you do it with the motive that I really want to learn, I really want to help this resident succeed, and you're not coming at it from a punitive point of view, you have a chance. And then at the end, gosh, that was a great conversation. Next week, let's find some time. Let's find a time to talk about it some more. I'm really interested in what you have to say. You've given me some good ideas, too, about how I might structure my day differently, something like that.
Thank you.
Any last questions or comments? Then I'll invite you to join us next week. The 17th of October, we have a program co-sponsored with the Cancer Center, Taking a Shot at HPV and Cancer. And this is going to be about the HPV vaccine, both its efficacy, but also some of the continuing sociocultural issues around families' choices to use this vaccine or not. And we'll have a panel from around the health system here. Also, Tuesday evening, the night before, at 6 o'clock, up one floor from here in rooms 2A, B, and C, there will be a free public screening of a documentary film about the HPV epidemic and the vaccine called Someone You Love, the HPV Epidemic. And it's a wonderful film. If you wanted to see the whole thing, we'll use a few clips from it in the medical center hour itself. But if you want to see the whole thing and engage in some crucial conversations about it, please join that, and you have information about that in your handout, and there also is a number to call, including with information about parking. Always a perennial problem here. Thank you all so much for being here, for participating, and for Dean Gianakos and leading us in this series of conversations, and giving us all a time to talk about burnout. Thank you.
Thank you very much.